From a hygiene perspective, you'll want to use just a regular saltwater rinse. It's mild, it's not as caustic to the tissue as something like a Listerine or an alcohol-based rinse. This is a gentle swishing kind of a motion, nothing real vigorous. And all it's meant to do is try to keep that area clean without having to manipulate the surgical site with like a toothbrush. You can expect to have bleeding with the site. We provide you some extra gauze in your take-home bag to be able to use to address that issue. So the more pressure you put in the surgical site with the gauze packs, biting pressure, the sooner you'll clot, the less you'll bleed. So that's always our encouragement. If you're having issues controlling the bleeding, we'd encourage you to call the office so we can give you some additional pointers on things you might do to help address that. The more impacted your tooth, the more you could expect to have swelling associated with the surgical intervention. Swelling is very easy to manage if you're able to ice the surgical site. And so with the ice packs we've provided, we'd encourage you to use ice 20 minutes on and then 20 minutes off to let the site recover from the cold, and also to give you a chance to get that ice pack cold again in the freezer. Your diet is going to be important from a pain management standpoint. The softer your food is, the less pain you'll have as that area compresses up against the surgical sites. Particularly if you've had an exposure on the roof of your mouth, you want to avoid any real hard or crunchy textures. Just because every time you swallow, of course, that'll put pressure on those surgical sites and that hurts. So the softer, the cooler you keep your diet for the first week, the less pain you'll have with those surgical manipulations. Your activity levels should correlate with the pain management protocol that you're using. If your pain's intense and you're needing the narcotic pain medication that we've prescribed, your activity should be limited. Shouldn't be driving, shouldn't be working, students shouldn't be at school. As soon as you can transition to medication that's over the counter, that's when your activity level should and can pick up. The most important thing is to avoid any real intense physical activity like sports or heavy lifting or intense cardio exercise for that first week. Nausea is a common side effect of IV anesthesia. It tends to be short-lived as the IV anesthetics are broken down by your body. If you're having nausea beyond the first day after your surgery, it's typically related to narcotic pain medication. We're going to ask that you transition off of that medication as quickly as possible if you're having issues with nausea. We also typically prescribe an anti-nausea medication that would need to be part of that regimen to try to combat any post-operative nausea that you're having. But the first thing we're going to ask you to do is transition away from narcotic pain medicine.